People in the rare disease community talk a lot about hope. What does hope mean to you in practical terms? How does that embody?
I think that's what gets you up in the morning. That's what drives you. There's a lot of long days in the lab and through meetings and planning what we're going to do and making that happen. And so on our side, to know that there's a patient on the other end of that who needs that therapy, and we can provide not just the hope of that, but the delivery of that. And for them, to know that we're working, that we are, actively involved in trying to make that happen.
And to build off of that, I mean, it's the actions that we take to build those medicines, and that is building towards hope every day.
Right, so it's not so much a passive thing where it's more equated with believing, it's believing combined with building, right? It's action.
Right, and it's not just for a lot of the team members, but it's also for the clients, that we're hoping we're going to be able to provide them and their patients, their investors, their stakeholders, hope that a quality team is going to be able to build and manufacture those therapies that can help meet their timelines and basically really accelerate on how we get these types of exciting therapies to patients.
So it sounds like that really is the ultimate goal, right? Bringing healing to people that need it the most.